I'm Shauntel Leeson, and welcome to Money Talk Viewpoint. We are the online talk show and podcast for financial professionals who specialize in working with high net worth, ultra high net worth, family-owned businesses and family offices. We have a panel discussion. This is our first of our panel discussion series. We'd like for you to consider joining us in the future, and we'll put out a message on LinkedIn and Facebook if you're interested in our discussion topics and to be able to join us. So I'm going to kick it in gear. Introduce yourselves one by one, starting with you, Mary. Anyone introduce yourself and tell them what you do?
I'm Elaine Petrucci, and I work with family caregivers, coaches, and holistic practitioners in terms of reducing their stress, overwhelm, and burnout using mind-body programs and hypnosis training.
Katie?
I'm Katie Pfisterer. So we have our own insurance company, Pfisterer Retirement Insurance. So we do health and life insurance for different ages, but our primary focus is on Medicare. And so we also provide additional plans, long-term care plans, and other things for the age group as well.
And Katie is a partner that will come on in a few minutes. He's coming on, right?
Yes.
Okay. And the next person is actually my co-host. This is Dennis Williams. Dennis, how are you?
I'm doing well. Thanks much. My background's primarily been in healthcare and finance, and recently launched CashMap Consulting, which is focused on strengthening family finances, whether it be boosting credit score and eliminating debt or paying less interest on what you end up paying, and just bringing clarity to your finances. And just a pleasure to be here.
You know, and I want to ask something else what Dennis does. For those of you who are small business owners, what Dennis does with the cash map, if I'm correct, it helps to track cash flow. Am I on target with that one? It
does assist in bringing clarity to kind of cash flow, as well as providing some very simple cash flow strategies that kind of move people forward to their profit targets.
I'm going to shift views, and you're going to just see individual views one at a time. I'm going to start with Mary, because Mary's our star for today's show, because Mary specializes in caregiving. This is a very, very difficult phase of life. It's not the sexy phase of life, but it happens to a lot of families. And it puts a lot of families in a turmoil, which is why we have Dennis here to talk about cash flow, because it puts their bank accounts in turmoil. But the emotional effect of when someone goes through that phase of life where they can no longer care for themselves, whether it's through physical illness or mental, emotional illness, can be damaging and devastating to a family. So I'm going to start with Mary. Mary, I'll let you kick this off, and let's start with you, because we talked about caregiving and communication. Start where you want to start, Mary. It's your floor.
Thank you, Shauntel. Communication is just really important when caregiving, because you have to really take in someone else's perspective and know how your loved one is really communicating with you, so that there's less chance of miscommunication, and it really promotes stronger relationships when you can communicate much better. Just to give you some idea of the ramifications, I guess, if you like, of caregiving, are that about 35% of caregivers report that their health is fair to poor. 40 to 70% of them have clinically symptoms of depression, and 30% of caregivers will die before the one that they're caring for. So communication is really important, and finding like the resources that they need to help them in their caregiving journey.
Thank you. Listen, I want to introduce one other person. He's there, but he was hiding in the background. Jonathan, introduce yourself to the group. We've all done our own introductions, and tell them who you are and what you do.
Well, hi, and thank you. And I was hiding. You found me. Well, I'm John Pfisterer. I'm with the Pfisterer Retirement and Insurance, and my wife over there that you saw. Well, we're a family practice, and we've been doing Medicare, Social Security, and retirement assistance for free for families and individuals for the last 6-7 years out of the Chicagoland area.
So I'm going to open the floor up to open discussion. Who wants to step in first and pick up where Mary left off? We had talked about communication in the past. Whatever subject you want to talk to, this is open to the audience. We're inviting the audience in the future to engage in this conversation. It's still brand new for us. Wherever you want to go, whoever wants to step in next. Go ahead. Jonathan, you want to step in and talk about what you guys do with
I mean, I thought I saw Dennis's mouth start moving. I don't want
to. Yeah, I was just going to add this issue of communication. It impacts every single component of the healthcare continuum. It is just, I've just seen it so many times as relates to a hesitance of people even wanting to talk about their finances, and what it in turn does when that communication doesn't happen. I would also call it just compassionate. I mean, self-care is also effective communication as well. It encourages it for the simple reason that if you're not taking care of yourself and you're not, and Mary's talked about this before, establish clear boundaries. So you're just not on the receiving end of not taking care of yourself, then that also contributes, if that's not there, to bad outcomes.
You know, I want to ask a question about that, because when people go through that phase of life, they sometimes, if they don't have a process set in order, it will go through the bank account pretty quickly, won't it? Mm-hmm. Mm-hmm. Let's talk about that aspect of it, or if that's where you want to start, because this is where Jonathan and Katie come in to talk about the types of coverages that a person could put in place. When should they be looking at this, and how does it protect them? Jonathan, Katie?
So it's something that we definitely need to hit on earlier in life, because of your health, and you want to make sure that you're actually going to qualify. So there's different options out there. There are long-term care plans. They're not quite as big as they used to be because there's not as many companies involved in that. So there's not as many options in that field, but they've come up with some new plans too. And so some people are even using life insurance now to actually cover those costs later on in life. But again, that's something that you have to build up over time. So it's different than long-term care. Some people have a confusion between long-term care, like universal or whole life. And so long-term care is only going to be for a certain period of time. And that's not long-term, my mistake, term insurance. And so with that, it's going to basically be for a certain period of time, and it's you use it or lose it. And so sometimes people think they have coverage just based on having that, but that's in case of like a death. That's not really covering any care needs that you may have. So it's something you want to start talking about early on, even for yourself to consider. It's very easy to procrastinate and put it off. Like you said, it's not a sexy phase of life. People don't want to think about it, talk about it. But we're all going to need some form of care, whether it's home health care or we're going to need assistance in a facility, whatever it might be.
You know, one thing that Dennis touched on too is the fear of, so, you know, we're all here to help in one way, shape, or form, right? So a family, friend, client, and if they don't share the whole picture with us, communicate their financial situation, that's going to help us steer them into different circumstances that's best for them. Whether they're rich and young or poor and old, whatever that is, there's different options and opportunities for each one of them to get something, some sort of coverage or assistance through the county or the state or what have you. Different. So, you know, the tackle or the tap on top of what Katie said and Dennis is just, it's all really intricate and important.
Well, let's talk about the rich and old. You said rich and young. How about the rich and old? There are wealthy people in their older years. How does it impact them?
Well, you know, there's an old adage where, you know, how the rich stay rich, they don't spend their money, right? And so it's really quick in these facilities. And if you have to go into memory care, or if you're having people around the clock hired at their home, $1 million or $2 million, you can blow through that within a handful of years. And so is that really a lot of money? I mean, it is to most people, but at the same time, what do you do after that?
That leaves the people at home with a lot less in their bank account. Mary, I want you to go in and tell us more about what your experiences have been. And you have I want to say that Mary had the Caregiver Academy and the Caregiver community. Mary, share with the group here about the Caregiver Academy, how you've helped people, and the caregiver community.
Thank you for asking. I help caregivers in terms of really addressing like any trauma that they may be experiencing. So looking at any limiting beliefs, strategies that they're using that aren't really helping them at this point in terms of caregiving for someone, looking at their values and looking at just how they really communicate and with someone else, and how I can help them through that process so that they can overcome their trauma, so that they can be the best person that they can be, so that they can be the best person in terms of caregiving for someone else, because they'll step back and look at the person in a totally, that they're caring for in a totally different way. So using mind body programs and assessments and hypnosis can help them with challenging situations so that they can be more present with the person that they're caring for and be able to provide really deal with any challenging situations that arise, and will help them decrease the negative behaviors of the person that they're caring for in terms of understanding how they're communicating with the person that they're caring for, and understanding how the person that they're caring for is communicating with them either verbally or non-verbally.
You know, the factor is that when somebody's going through a long-term care problem, the people that are there to take care of them, it impacts their lives equally. And if you are, and oftentimes it's a family member, usually it's a female family member who steps down from her career to take care of whoever it is that needs help in the family. Dennis, you have really built programs around long-term care. Can you share with us some of the things that you've noticed or what you've been able to help people to do or address that issue of long-term care?
Well, I think there are really a couple of issues that I'd like to bring up at this particular point. Number one, unfortunately, nobody likes to think about themselves even being in this situation. And so a good part of the challenge that certainly that Jonathan and Katie run into, as well as what Mary is assisting people with, is really the challenge of when people are finding themselves in a situation that they didn't actually think or plan for going forward. So you've got everybody now in a crisis mode. So let's just kind of take a step back. Most people don't think that they're ever going to have any cognitive issues. I can think of a case while I was CFO at a hospital in Hawaii, of a young lady on her way for her final defending her PhD, her thesis, 34 years old, gotten into a car accident, head trauma, and now she will be there the rest of her life because of the subsequent behavior issues that have come out because of that trauma. So one of the things to consider is there's a higher probability of someone becoming disabled than they are of dying. And so when you think about a disability, you may have disability coverage to deal with income. But if you're finding yourself needing long-term care services because you can't do the activities of daily living anymore, health coverage, medical plans don't cover that. And so the idea of, everybody waits till they're in their 55 plus But there is that possibility that someone's going to need it sooner. And of course, the younger you are, the cheaper the rates are as far as being able to provide that coverage. So that's number one. Number two that comes into mind is that, if you begin to think down this road and ask the question, the individuals in your circle, how competent are they and how comfortable are you with just trusting them to do the right thing? And because I've also seen that where someone will have what we call an indemnity product in long-term care, which means they just give you all the money so you can spend it the way you want, thinking you're still going to have cognitive skills. But if you haven't thought, what happens if I don't have it anymore? And therefore, I don't have the ability to manage this money. Who would I want to kind of be that backup for me to make sure that this bunch of dollars that now comes in is going to be spent appropriately and not be whittled away, which is one of the advantages of a long-term care product. It was what they call reimbursement, because the long-term care plan requires there to be particular parameters met before they're going to pay for a service. So again, the key item that I'm bringing up here is think about what approach you are going to want to take if you no longer have the cognitive ability to direct your own care. And who do you want to have speaking for you that you can trust?
Let me ask a question. I hope I'm not stepping in the wrong territory here. Let's say it's not a person in the family. Is that something that is that a legal issue that they have to have that included in their trust or living trust or something of that nature? Or are you able to address that issue, Dennis or Mary?
Yeah. Well,
or any one of you.
Mary, I'll let you go first.
Thank you.
Full screen.
My concern, as everyone has said, is really preparing like all the legal medical insurance forms before something happens. So you either have to have like a durable power of attorney, a medical power of attorney, you need a living trust, or at least a will stating who you want to help you with your finances or your medical care. So you need things like a living will or advance directives so that people know specifically what your wishes are. And they need to be done as soon as possible so that because like Dennis said, with that 34-year-old PhD student, you never know when something might occur, and you may not have that ability to really have the cognitive wherewithal to really tell people what you want, who you want to represent you with your medical needs or your financial needs. So any way that people can, as young as, late teens, early 20s, come up with at least some kind of a will and get like all of their medical, financial, and legal documents in place should anything happen.
I'm going to say, you mentioned late teens, early 20s. They're not even thinking at that level.
No, they're not.
And then I think unless because I have a 22-year-old daughter, and I can tell you right now, her mind's on one thing. She's traveling the world, and that's all she's thinking about. But I would say that from a realistic perspective, is it more like when they're in the workplace, somewhere about middle 20s and later on, we should be focusing on, and this is something that they prepare from at work in the HR department, or is this up to the individual to figure it out what to do?
I think HR departments are helpful. Let me give you share an example like Dennis did. I worked for a neuro rehabilitation company, so we provided coma stimulation, psychosocial programs, community reentry programs, and acute and coma stim programs. And there was a young person that went on vacation and experienced a near drowning, and now he was going to have to be on state Medicaid because he chose not to sign those health benefits. And I guess he had the forms in his desk in a drawer at work. And now there is nothing he can do about changing the circumstances, because now you're looking at state Medicaid, and you know, your choices are really limited about the type of care that you will receive.
Jonathan, I know we talked in the past about the different types of coverages there are. And we talked about insurance policies and annuities. Can you tell us more about that type of thing?
I'd be glad to. And really, it comes from what type of walk of life you're in. And so Katie talked about it a little bit with life insurances and stuff. And, you know, I've talked about this before. So back, 10, 20 years ago, there was over 100 different companies out there that was offering traditional long-term care. And in the last 10 years or so, I believe it's 10, 11. John Hancock used to be in the business. That's what one of the things they were known for. They're no longer in it. So really left the market to create a new solution to the long-term care, because let's be honest, everyone's living a lot longer than they used to. And so we're lingering in such a state. So there's really, and Dennis talked about this too, these indemnity plans. There's a few channels here. If you're affluent and you have money and you have a bucket of money, so do you use your bucket of money, or do you use that and put that into an insurance product, whether that's an annuity or a long-term care plan? Do you prepay? Maybe. I'm a big fan of why use your money when you can use the insurance's money, right? That's what it's there for. So life insurance is a play, and the younger you get it, the more you can get for it, for the cheaper. And that's usually the way we recommend people go today. And that's where a lot of insurance companies have done. They've put these riders and these extra add-ons to a life insurance policy.
Well, so let me back up a second here. So if the person, is that like a whole life insurance policy or?
Yeah, sure. So Katie touched on this also. So there's 3 types of life insurance policies that are out there to an individual, not including group life and things like that that you could get through work. Usually you don't get to take those with you. So we'll just leave that for another day. So the 3 types of life insurances is term insurance, meaning that that's something that you rent. You have it for X period of time, whether it's 5, 10, 15, 20, 30 years. And then when that time period's up, you might have the ability to extend it at your new age with the new rate, lower your death benefit, things of that sort. So we help our clients and things like that shop and make sure that's the right thing for them. Whole life and universal life are the other 2 options here. And these are what we consider more permanent life insurance, meaning that you're taking it out for right now. You're going to get less benefit than you would with the term insurance, but the percentage of people that actually make claims on their term insurance is like single digits. It's like 2, 3, something real low, which is why it's really affordable. So universal life and whole life, these are the big questions. What the heck's the difference between these two? And there's different versions within those versions, but we'll go at a high level, right? Whole life is X dollars for the rest of your life, paying that dollar amount for a certain benefit. And that's a little bit more expensive than a universal life, where you pay a little bit less money and you have a little bit more death benefit, meaning the payout to the beneficiary once you pass. However, this usually has some sort of a tie-in to some sort of growth feature, whether that's the S&P, a fixed, or something of that nature, and your value increases over time, and the insurance is going to pull out. And as you get older, the insurance costs more. So you're hoping that the insurance policy cash growth is higher than the insurance cost in the next 20, 30, 40 years. So just because you got a universal life policy 20, 30 years ago and you think you're great, a recommendation is every 5 years or so, you should really pull a new enforced illustration, see where your cash is at, see where your trajectory is. Are you losing money? Do you need to put more money in there? And what riders did you have? And that's the big important thing here, is the riders. Because today the riders are add-on features You could utilize inflation protection, cash protection, loan protection, accelerated benefit rider, and that's the big one that we'll talk about today, which is using your death benefit if you meet XYZ criteria to pull out money to utilize for long-term, short-term home health care type of situations. And that's where a lot of individuals today are utilizing, because it's not a use it or lose it feature like a long-term care plan. You spend $120,000, $100,000, $1 million in it, you pass. Guess who keeps that money? The insurance carrier. The life insurance, it still goes to your beneficiary, tax-free, probate-free, whatever's left over. And that's why it's a really sweet deal. There's usually no waiting periods other than processing the forms. Unlike long-term care, you can have a 90-day waiting period. So what do you do for the first 90 days? Kind of on your own. So that's a lot of stuff I just said with a lot of different features, functions. And that's why it's important to have a conversation with somebody one-on-one about you specifically.
Let me just add one thing to that. So in a permanent life insurance policy, they put on what you call a rider. And in that rider benefit is where they can use that rider benefit for long-term care or home health care and whatever. Let's go back to the home
There's
health
differentials,
care.
right? So there's different rules and stipulations on each one, and carriers have different rules on that and what they're doing.
Let's go back to the home health care. Any one of you, I'm going to put it back on a group view. Let's talk about home health care. What's at someone's disposal? Who qualifies for it? Are they covered for that in the insurance? Any one of you step in and start with that.
I think with home health, that clearly is people want to stay in their home. And so from that perspective, and it's just kind of generally known, a general rule of thumb that people in healthcare know is that that being home is always a healthier place than being in a facility. It just is from a social perspective. And so home healthcare gives the person that flexibility. Now, the challenge that people are facing is we don't have enough home care providers to come into the home, but that's a whole nother different conversation. But I would like to just briefly roll back to just one simple comment, kind of back to planning. And that is, if you have a power of attorney in place, and I'll use my parents as an example, they each had a power of attorney, and each of them was the other, and I was the backup. And one of the things to consider is that if they both pass, or one passes, excuse me, and now it kicks in and now it kicks in that as a case, the secondary, like my case it was. If something happens to me, now you got a big problem. And so again, that's not something people usually think about. And that's another reason to have a trust in place, so that you don't find yourself, the person who you trust, something happens to them, and the individual who needs the help it's kind of up to who's going to be appointed, and that person being appointed may not be the best person to be in the role. So from that perspective, it's taking that time to think in terms of these what if scenarios that you might never consider as relates to who's going to be the best person. And that can also involve another option of having somebody entirely separate to be doing the finances versus the person who's responsible for kind of providing the care. And so again, it has to be someone that you trust. So that, that opening statement from Mary about the importance of communication and people thinking in terms of what if scenarios, just we as individuals are not good about, in any aspect of our life, of asking the question, what if this does not go as I had anticipated? What will now happen? Mm-hmm. And unfortunately, what I've seen in long-term care is the individual who's now having the problem, they don't want to lose control. And so again, back to communication. How do you effectively begin to think on your own the reality of I'm not in control. I can't be in control. It's not in my best interest to think that I can be in control. And in turn, what steps do I take with that reality?
You know, you said something, and just because you made a trust 10 or 20 years ago, guess what? There's probably new family members, new, grandkids, someone may have passed. Revisiting, it's a living, breathing document. Like you said, different walks of life, people are doing different things. And so what's the backup plan of the backup plan? 5 years later, that now we got to redo it. So redoing and revisiting your trust is probably the most important thing, specifically if you haven't even looked at it in the last 20 years. Oh yeah, it's in my drawer over there. Okay, great. Who's still living around you?
I was going to say, financial advisor, though, that's something we did. I was a financial advisor, fee-based advisor, and we had an annual meeting.
Well, they're supposed to, FAs, right? That's what they're supposed to do. The good ones, right? And the other thing too, you said, Dennis, we find this all the time when we're talking to our clients and we're creating a retirement plan for them and whether they're rich or poor, is what do you want to do? Right now, you have your own mindset. Would you rather go to a facility, rather be home? And 9 times out of 10, it's I want to be at home. All right, great. Then what? Well, who's going to take care of you? Should mom and dad really be taking care of each other? Probably not, because we know in our business, a fall will change your life. And if somebody falls and you try to pick them up and then you fall, now what happens? Now, go reaching for that trust and figure out who's going to be taking care of people. So the home health care, and there's so many different avenues on what a home health care policy procedure looks like, whether you're getting help through the state, you're getting help through insurance, you're getting help from family members, and now is it custodial care? Or do you just need some physical therapy? So there's a lot of different aspects and views that you should really be looking at when doing that and planning for. And home health care, as far as like insurance policies go, is probably one of the most affordable ones that are out there, because you're not spending money on room and board. You're spending money on by the hour for these individuals.
More personal. We got we're running over time. It's okay. Mary, I want to give us a wrap up for this. Because Mary was the one that brought this to our attention. This is her main focus. Give us your feedback, Mary. Give us your wrap up for the day.
Like we started, communication is just really powerful, and it's something that we need to take into account. We're bombarded with information, like 2 million bits of information per second, and we're able to use our different filters, generalization, distortion, and deletion filters to get it down to about 134 bits of information, plus or minus 7 bits of information that you can handle. And because of that, and because of the person's experience and background, there could be so many options for miscommunication. And I think that it's really critical for the person looking for care and the person providing the care to really step back and look at what the person that they're caring for is saying to them, and try to fill in those bits of information that may not be clearly communicated. So just really stop and think and really express how you or what you want, and find those resources, whether it's legal, medical, insurance, options available to you so that you can have everything in place before any emergency occurs. And also, like everybody has said, reviewing those documents on a regular basis so that when you're able to communicate your needs and your wants, you can make those choices. instead of having someone else make them for you, especially in an emergency. So like reviewing those documents, getting them in place early is really important.
Thank you, Mary. We're going to wrap up here today, and we will be back again next week on Thursday, the 22nd of June. I'm going to stop our recording at this point. Thank everybody for coming. And give me a second here. We're going to stop, and I'm going to ask you guys a couple of questions.